So today we will be discussing using functional communication training as a way to teach appropriate commands and requests within students in Willow Preschool. So the scenario that we're in here is there are preschoolers in an urban area, and about 20% of them that are receiving speech therapy engage in tantrum-like behaviors and aggression when they want to either play with their friends or, receive a specific item. Now, a lot of these children have various disorders, and they all are under the age of 5 years old. So we've created a team that consists of a BCBA, SLP, OTs, and a few other personnel around the school. The goal here is to teach these students functional communication so that they do not engage in harming themselves or others to receive what it is that they want. Although this is specifically for those with disabilities, we are hoping to include everyone at the school, even though the procedures are specified for those with disorders. So an introduction to what functional communication is. Functional communication is the process of differentially reinforcing a new behavior and teaching a new behavior and reinforcing that behavior to give the child an opportunity to receive what it is that they want by requesting it or by engaging in a behavior that isn't the behavior that we're trying to put into extinction, such as aggression or tantruming. Now, we do this by going through verbal operants, which is the outline of how people communicate, whether it's manding, which is what we want to teach, the requesting of an item, intraverbals, which is the ability to be back and forth. It's a conversation such as, what is it that you want? I want toy, or coex, just being able to repeat words that they hear. They hear somebody say train, they say train, or tacting, their ability to label what it is that they want. They see a train, they say train, so they know that that item is a train for them to man for it later if that is what they want. We shape various man frames. It can be one word mans, 2 word mans, 3 syllable, what have you. We can do approximations, of words. It doesn't even have to be the full word. But man frames, you can do the may I want, can I, you can dog please, toy please, play please, help please, things of that nature. Those are various man frames. When we're teaching functional communication, we want to use a process called errorless learning. Now, the reason we want to use errorless learning is because we want to make sure that the learner gains access to the reinforcer, and that way they understand and they connect that asking is how they can receive access to this tangible item that, they were looking to receive instead of, engaging in tantrums or aggression towards their peers. Now, when you're implementing errorless learning, of course, we want to go most to least intrusive, but we still want to allow for opportunities of independence. So oftentimes, we'll give about 3 seconds to let them respond and see if they're going to go into the right direction. Obviously, if you see that they're not or they're not responding, we'll go in immediately and we'll prompt and reinforce. The factors of functional communication are, of course, our positive reinforcement, the motivating operant, the thing that they want, making sure that we're contriving and capturing situations and delivering that reinforcement. We always want to make sure that we're prompting and giving contact to that reinforcement for the appropriate behavior. The immediacy of the reinforcement delivery is so important because, if we have delays and something else happens in between, now we're reinforcing the behavior that happened prior to our reinforcement instead of the replacement behavior that we're teaching. Now, Willow Preschool is, as mentioned before, is facing aggression, towards peers and vocal protests and tantrums for access to tangible. Now, how will teaching functional communication address these issues? Well, teaching the replacement behavior of manding would decrease these tantrums and aggression because mans will get them what they want instead of the tantrums or the vocal protests. The replacement behavior would teach students a new way to obtain access to these tangible items that they're searching for. Now, when we're working on training function communication, the things that we'll need are, of course, the preferred items that they're desiring and AAC devices, whether that's their PECs or their speech generating devices. Whatever it is that we're using for these students, because some of them are nonverbal, and of course the ones that are verbal, we can utilize vocal mans for them. These trainings will take place during the daytime, in the mornings and in the afternoons, including the parent trainings. They'll be focused more in the afternoons, allowing the parents to come in after days of practicing, the day of practicing, and allow them some opportunities to develop instructional control around getting these children to request even from them. Now, as mentioned before, when we're teaching functional communication, we want to utilize airless learning. Now, some of the steps of airless learning really just include making sure that we don't let them make mistakes. But what this is going to look like for us is making sure that we identify the motivating operant, the thing that they want, and we want to pair ourselves with that item so that we're not just automatically coming in, giving demands, and creating a stressful situation. We want to make sure that these students, these clients, view us as fun, and as a person who can get them what they want. So now we want to use airless learning. And like I said, that's really just making sure that we're going in with the most intrusive prompt and allowing them not to make a mistake so that they can gain contact to reinforcement. And then we want to make sure that we're contriving and capturing multiple opportunities while fading out these prompts. We do not want them to become dependent on us prompting them to tell them what they want or to tell us what they want, in order for them to receive what it is that they want. So we also want to make sure that during the contriving and the capturing, we're following the things that they want. Sometimes they can become satiated with the items that they're playing with. And it's important to notice, like, they are not happy and engaged with this item anymore. And if there's something else that they want, we can use this opportunity to get them to simply ask. And during that, we can make sure that we're prompting. Now, we're going from most intrusive to least intrusive while maintaining a steady rate of fading and always reinforcing those appropriate demands and requests on the reinforcement schedule outlined by your BCBA. And so, when we're prompting and we're going from most to least, that could be full physical, partial physical, going down into vocal model, partial model, partial vocal, all the way to independence. Our goal here is to get them to do it independently. And then once that happens, we want to, make sure that we're getting as much repetition of that independent man, that request, as we can. And we'll slowly start to see that this replacement behavior is starting to become more frequent, while the interfering behavior from previous is becoming less frequent. So let's take this opportunity to practice. Okay, so this is our model for what functional communication will look like. In this example, I will be demonstrating prompt hierarchy from full physical to independent. Now, I do not have access to SD speech generating devices. I do have an iPad, so I'm going to simulate what it will look like requesting on a talker for an item. So here's the iPad. Set that up. We can't see it in frame, so I'll imitate. Now, the desired items are going to be tangible. They're going to be food. I have snacks. So we're going to use that as an example. So the client comes in, they're at the table. They see you have gummy bears. Now they are reaching. They're gesturing that they want it. They're grabbing and, making vocalizations. You see that they're interested in this item, and before they go into engaging into problem behaviors such as aggression or tantrum, you go in with the immediacy of a prompt. Now, this learner has just gotten an AAC device, so the first thing that you do is go in and you find what it is they're looking for, which is, we'll just go with eat. So we'll click more, eat, and take their hand. This is the full physical prompt. We'll take their hand and have them press eat. and they will emit it. Oh, good job asking. Here you go. And you can give them one. Typically, you want to give, this is a pretty large, you want to break them up, give them a piece. One, you don't want them to have that much sugar, and two, it creates more opportunities for them to ask for more, and you can kind of go down. So now they have a piece of the candy. Now, of course, they want more. So, you'll wait a couple seconds. They're starting to reach again, reach. So you're like, oh, okay, I see that you want, more. You can ask. You wait. There's no response. So you go. You take their elbow this time instead of their hand. This is going to be a partial physical. You'll take their elbow. You'll kind of guide it, hover it over, and then get them to press eat and eat. Oh, thanks for asking. Sure, here you go. You could have more eat. Okay, so now you've done your partial physical. Now as obviously you're going to have to get a few more repetitions in this, but you want to keep working your way down. So now what we're going to do is showcase a model prompt. So now they've had a couple bites of the candy. They want some more. So now you get, okay, I see you want some more candy. How do you ask? Now we're going to use a gestural. You're pointing towards the talker. Eat. Oh, thanks for asking. Here you go. So we're working our way down. So finally, you want to get to the point of independence. So they see the candy on the table. They see their talker. They see the candy, they'll walk. Eat. Oh, thanks for asking. Now we can use actually a lot more praise because that was independent. We want to make sure they know, like, this is definitely how they get it. Oh, yeah, of course you can get it. Here you go. You can give them a larger piece, a lot more excitement and things like that. And that way we're definitely reinforcing that independent man for the item that they're requesting. I hope that was helpful, and now we'll move on to the remainder of the presentation. Okay, now we will go into the parent training. Hey, mom and dad. So I understand that at home it can be very difficult to manage, problem behaviors. Your child is hitting their brother and sister. They're throwing things. They're throwing themselves. They may be hitting themselves. And all they want is a snack or to watch TV or the iPad. So in this training session, what we're going to do is get a quick introduction to the errorless learning procedures, and then I want to show you how to do error correction so that in your household you can teach these skills to your child, and that way they can go about their day and actually ask you for the things that they want. For instructional purposes, I do not have access to AAC apps such as Speak for Yourself or LAMP and things like that. So what we'll be doing is we'll be mocking use of a talker for instructional purposes. And also they have PECs and things like that. We have ASL for our MANs as well, but for instructional purposes we will be imitating what it would be like to utilize a speech generating device. Thank you. So mom and dad, you're at home. We're going to set the scene. You come in, it is now time for dinner. The child wants chicken nuggets or what have you, and you give them that option. You say, hey, do you want fish sticks or chicken nuggets? They don't know how to respond to that, but they're throwing themselves, they're pointing at the chicken nuggets. They're trying to say chicken nuggets, but they can't actually say it. So now is the point where you would take it upon yourself to go grab their talker, bring it close to them, and you will go in immediately with that prompt. You will take you're going to go in with the full physical prompt. So you will take their hand, find what it is that they want. If you have chicken nugget on your talker, then you'll find that word chicken nugget. If not, you'll find something general such as eat or chicken, and have them press it in for the man for instructional purposes. So we'll go with chicken as the icon that they have on here. So you see them, pointing for the chicken nugget between the option of chicken nugget and fish stick. You'll take their hand. You'll find, let's say it's under animal, chicken, and the device say chicken. Oh, okay, you want chicken nuggets. Sure, we can have chicken nuggets. And this is a naturalistic opportunity that you have at home to work with your children for requesting things on their devices. You can also use them for things like watching different TV shows, If the kid loves Disney, Disney Plus, he wants to watch Moana and things like that, you can have him or her request using their device of that nature. And like I said, you want to make sure that you're fading these prompts. So if you guys are eating, let's say you eat in front of the television, you ask, "Hey, what do you want? What do you want to watch?" So now you can gesture towards the talker, like, "Hey, tell me, what do you want?" You're pointing. They're scrolling, they don't know what to click. Now this would be a version of error correction. Now they know what it is that they want. Like, they've told you many a time that they love Frozen, they love Moana, and that they know how to find this. So now we're going to go in with the teaching of an error correction, where you allow them the opportunity to try to go for the independent selection. And if they mess up, you go in immediately and correct it. So you say something along the lines of, "Oh, what do you want to watch?" And they're eating their chicken nuggets, so they press chicken. You're like, "Oh, okay." So now instead you'll open the thing. Let's say it's under more and Frozen. So Frozen. "Oh, okay. Do you want to watch Frozen?" You can test it like that. Now, during these times, usually what you want to do is have an indicating response of some kind, because you don't want to, prompt the wrong answer and then reinforce it. Obviously we want to make sure we're giving them what it is that they want. But as parents, typically we would know what our child is interested in, and we want to teach them that they can ask. Like, if they're interested in something else, we'll go through that procedure. But obviously they don't want to watch Chicken Nugget. So we'll go in, we'll correct Frozen. We'll turn on Frozen. We'll see if they're happy and engaged. If they seem like that's not what they wanted, maybe it was Moana. And, we know that those are the two things that they watch the most. So, for that example. And, for follow-up trainings, which is we'll go over, we want you to practice. So the next time that I see you guys, we will go over this in your home. Currently, we're sitting in my office and, we're using these mock things. But when I get there and the SLP has assigned, whether you guys are going to be using PECs, or if you have an iPad and insurance will approve, further use of higher tech devices, we can practice with that. But I definitely wanted to just demonstrate what errorless learning was, and that is, going in immediately, prompting, taking hand over hand and getting them to select the answer, and error correction, which is when they typically have given you or shown you that they can respond independently, and now they may just have made a quick mistake based on overgeneralization or something like that, and it's your job to go in and correct it and then reinforce that correct response. Thank you. So I'll see you guys next time at your home, so that we can practice these two concepts, and hopefully you're able to generalize functional communication in your home. Back to the presentation. For parent trainings, what we'll be doing parent trainings in the clinic and at home. A lot of times what we want to do, we'll start in the clinic to create a scenario that will relate in home, and then we will also allow some trainings to happen at home. That way we can focus on making sure that we're capturing generalization skills in the household that we are teaching in the clinic-based setting. Now, in the home, we will go over errorless teaching and error correction. That way parents can understand, at the early stages that we're doing errorless teaching. And after the kid slowly starts to gain these skills, we want to teach, these maintenance procedures and make sure that they understand how to correct errors so that problem behaviors don't arise again and become reinforced over the skill that was just taught. Now, let's take a moment and practice with parents. Thank you. So now we'll go into the school-wide protocol implementation. So what we have here is a positive behavioral intervention and support team that includes the BCBA, 2 pairs per classroom, 2 SLPs, 1 OT, and a teacher and a physical therapist. Now, all of these people will work together to make sure that these protocols are implemented for the students, so that functional communication, even though it's for the students with disabilities, that all students understand how to functionally communicate and request for items that they desire. So we have SLPs who will recommend the various AAC techniques and devices for the students, so based on their level of communication skill. So if the student is nonverbal completely, they'll decide whether PECS or an AAC device is, the best choice for them. Although funding for speech generating devices is limited, we do want to try to encourage parents, if they have their own iPads, to bring them and allow us to use them so that we can request from insurance the apps and that, for the students to communicate, such as Speak for Yourself and Go Talk. The BCBAs will implement the protocols and the procedures, such as differentially reinforcing and prompting the replacement behavior, and using and teaching them how to use the AAC devices recommended by the SLPs for functional communication training. So if the SLP recommends that this learner request and manage using PECS, in ABA therapy, we want to make sure that, we're reinforcing them using their PECS board instead of, their tantrum-like behaviors or aggression of hitting their peers, and, make sure we're blocking and reinforcing that replacement behavior. OTs will work on the things like their gross motor movements, such as picking up the PECS icon, and things like that, while also creating structured play groups to offer generalization opportunities. These kids are playing in OT and they're utilizing their gross motor skills to take their finger and touch the item on their talker, or to go pick up the PECS board and give it to their therapist for what it is that they're requesting. Now, the school will also hold regular training meetings that will best support the teachers and the education staff, so that they understand how functional communication should be implemented within the classrooms, as well as just around the school in general. We want to make sure that everyone understands and feels comfortable using, functional communication and, working through problem behaviors. We've also decided to request for grants for materials such as iPads, so that we can assign a lot more of our nonverbal students speech generating devices. Now, in closing, we want to remember 3 basic tips. We want to generalize functional communication as much as possible. We want to try to use as many core words as we can with these kids. Things like go, help, want, open, words that we use 100 times a day on a regular basis. We want to encourage these children to use these words as much as they can in general opportunities, not just in structured settings where we want to make sure that they ask to play with this toy, or, they want to go to the bathroom. Like, if they have something that they want to request, they should be able to do this in any setting, not just the clinical setting or in the organized settings with BCBA and parent. We also want to make sure that you're encouraging the use of these AAC devices recommended by the SLPs, because oftentimes, there may be there's already stigmas when it comes to children with disabilities, let alone the ways that they're communicating. It's not a normal circumstance that a person has to communicate with an iPad or with pictures. So we want to make sure that the learners feel comfortable, doing this, because this is how they will have to communicate, instead of, hitting, screaming, throwing themselves on the ground, or harming themselves or others. So we want to make sure we're encouraging the use of these devices so that they can get used to it. They can feel comfortable with communicating this way, because we want to make sure they have the best quality of life as possible, and that starts with them being able to request with the things that they desire, or when they want activities to stop. And of course, last but not least, practice makes progress. It's a slow and steady process of shaping up approximations of requests, and teaching them how to create sentences using the picture exchange system, or how to find words on their talkers to communicate. The more that they practice this, the more that they get used to this, the more that it becomes normal for them, that this is just how it will go, and they'll be able to ask for things on a regular basis. They'll know where things are that they want. And eventually you'll slowly start to notice that they're not aggressing towards themselves or others. They're not engaging in these tantrum-like behaviors and throwing things and throwing themselves on the floor. And that's because they have another way to tell you that this is what they desire. And this is the whole purpose of the functional communication training. And I hope that everybody understands that even though that this is a protocol for those with special needs, functional communication can be utilized across the entirety of the Willow Preschool, because all students should be able to be asked for what they want, whether it's vocally or using an augmented alternative communication device. Thank you.